because stigma can prompt social isolation of persons or groups and drive people to hide their illness, and also prevent them from seeking healthcare immediately. This could cause a situation where the virus is more likely to spread and increase the difficulty of controlling the outbreak response. So we did not stigmatize persons who have recovered from COVID-19 or even those who just barely tested for it. Having said that, I want to strongly advise that persons who test positive for COVID-19 enter into accredited isolation and treatment centers for proper management. This not only gives them the best prospect of survival and recovery, but protects their family, friends, domestic and office staff, and the community they live in from infection. If not, it will be counterproductive. We have developed various isolation and treatment facilities to meet all needs and expectations of security, privacy, and comfort. And I therefore urge citizens to cooperate with case managers. The fight against COVID-19 is like climbing a steep hill where we cannot yet see the summit. It is hard, persistent work. We must persevere together to succeed. The whole country is in this together, as the same with the global community. I urge you all to stay at home, stay safe, except you really must go out. And if you do that, remember the advisory for hygiene, respiratory hygiene, and also social distancing, and the use of sanitizers and a mask, especially including improvised masks, especially if you know you will encounter a crowd or you find yourself in public transport or any other place where people have gathered. Thank you. I shall now invite the Director of CDC to speak.
Chair, Honorable Ministers, members of the Presidential Task Force, ladies and gentlemen. So I'll start from where the Honorable Minister stopped, because there's an important issue we've been dealing with on our social media handles throughout the day. People have been asking questions. Where are the people living? Where are the people with COVID-19 living? What part of town are they in? What part of Lagos do they live in? So COVID-19 is a pandemic that has hit the world and disrupted lives in an unprecedented manner. With the constant reporting of cases every day on TV, on all channels in Nigeria and abroad, of course everyone is anxious and frightened. Unfortunately, this anxiety seems to be leading to stigmatization. But those of us that have worked in public health know that we've been there before. When the HIV epidemic hit our world, we did the same thing. It was even worse because it was a sexually transmitted infection. But this is an infection. It doesn't get to you because you've done anything bad or you've committed a crime. It doesn't get to you because you're an elite or you belong to a certain strata in society. It is not karma. It's not coming back to you because your forefathers did something wrong. It is just a virus. And we have to really think about how we treat people and how we continue allowing the humanity in us to always come through. The people that are infected have families just like every one of us. They have mothers, sisters, brothers, wives. They need to be respected. It affects their mental well-being. Of course it affects their mental well-being. If we our response as a society is to stigmatize them. It is preventing our work from happening because some contacts are choosing not to come forward, to hide, to run away, not to answer their calls, because as a society, we have started stigmatizing them. So this is really to appeal to all of us. You know, what makes us a great nation is our humanity, our love for each other. It is what has made Nigeria always stand out. If we start stigmatizing people because of an infection, it will not only disrupt all the great work being done across the country, but it will have a profound impact on our ability to control this outbreak and our ability to get back to life. So as we roll out testing, as we increase our testing, with all the pressure we've had to do so, it will be counterproductive if at the same time we stigmatize those that we're now finding to be infected. Because what will happen is that people will go underground, they won't come forward for testing, but they will be infected. And by being infected and staying underground, you infect others. And the cycle will continue. And the disorganization in our society will continue. And our economy will not be able to come back. So all these things are connected. It is not, we're not asking you not to stigmatize out of some hypothetical risk. This is a real risk to the challenge. So if you're tired of staying at home, if you want to get back to life, please support those infected, support their contacts, encourage them in any way you can. Call your friends if you know who they are. Show them that we support them. We're waiting for them to get well and come out. We've so far discharged 128 people. 128. Show them your love wherever you are. Reintegrate them into our society. As I emphasized last week, that while we maintain a reasonable fiscal distance, we do not want to be socially disconnected. In fact, at a time like this, we need to be more connected than ever before. In these times, what unites us is more than what divides us. Let's show empathy to others. Together, we can take responsibility in the fight against COVID-19 and associated stigma. Thank you very much.
The Secretary to the Government of the Federation, Honorable Ministers, members of the Presidential Task Force, ladies and gentlemen of the press, good afternoon. So, first of all, I'd like to talk about the issue of travel restrictions and to re-emphasize the need for people to stay at home, especially in the FCT, Lagos and Ogun. I would also like to briefly note the issue of people traveling in between states, interstate travel. We have noticed that community spread is now being traced from people traveling across state borders. We need to try and restrict our movements in order to stop the spread of coronavirus infection. This is particularly pertinent with regards to the news of people being smuggled in trucks out of Lagos, which is quite concerning to us. Moving on to the issue of distribution of palliatives, I would like to highlight the need for donors to safeguard life and basic health protocols during the distribution of palliatives within local communities. It is important that they maintain health and safety. The rise of aggressive behavior and the non-conformity to physical distancing is unacceptable and is a major risk to our communities. It's a serious public safety concern. I enjoin donors to work closely with local authorities and to ensure that the mass gathering restrictions and the physical distancing guidance that we have given is abided by. On the same issue of donors, I would like to remind donors that intend to support the COVID response on the importance of working with us through the Presidential Task Force to make sure that donations are relevant to our needs. We need to make sure that we do not purchase substandard goods or put quality assurance standards aside in the process of trying to increase our resources for the response. This is particularly valid for state governments as they go on to purchase PPEs for their healthcare workers as well as frontline staff. We will be providing guidance on the sort of standards we expect, which is derived from international standards, including the WHO standards for PPE and other equipment for the response. Finally, I know previous speakers have talked about the issue of stigma, which continues to be of concern to us. I would like to appeal to survivors of COVID to please tell their stories, but at their own discretion and for the purpose of reducing the stigma and discrimination associated with this illness. We can see how celebrities and other persons from outside the country are working very hard to enlighten the populace and prevent discrimination and ignorance. This has worked with other disease conditions such as HIV, and we are certain that it will work for COVID as well. While doing this, while supporting us, it is important that we continue to respect privacy. But if you are a survivor of COVID and you are willing to share your victory, because it is a victory, then this will definitely help us towards getting on top of the pandemic. Thank you very much.
Thank you very much. We have completed phase 1 of this national briefing. We shall now take the questions. We'll take 1 to 9.
Good afternoon, the Secretary to the Government of the Federation, Honorable Ministers, the DG and CDC, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My question is directed at the SCDC boss. Recently, we've seen countries like South Korea experience relapse. People with that tested positive were treated, became negative, and then they are positive again. What mechanisms do you have in place to ensure that we don't have such experience in Nigeria? And is there any form of education or advice you would give to Nigerians, maybe to families of those that have recovered and people around them? Secondly, my question is directed at the SGF. At the inception of this briefing, you made it clear that the PTF committee is working hand in hand with state governments to ensure that this whole project comes to fruition. Now, 2 days ago, the Adamawa State Governor lifts a ban on restriction of movement and other measures put in place. Don't you think this will jeopardize the efforts of the PTF towards curbing the spread of the disease? Thank you.
Good afternoon, the Chairman, Ministers, my colleagues. My first question is to the Minister of Health or the NCDC boss. Medical personnel who would love to volunteer to tackle the COVID-19 would like to know how to go about it. And then secondly, since we started the community testing in the FCT, we would like to know the success rate and how many we've tested so far. Thank you.
Good afternoon, SDF and members of PTF and my colleagues. My name is Mwangama Marachi, Voice of Nigeria. My question goes to the Minister of Foreign Affairs. I'll take first in English. There was a debt waiver from the IMF to some African countries. Nigeria was excluded. My question is there any plan by the federal government to persuade the IMF to consider adding Nigeria to this relief, considering the impact of COVID-19 in the economy. And secondly, there has been several harassments and attacks on people and by security agents during this lockdown. Just about 48 hours ago, the news we have on social media and from some newspapers is that people were killed, lives were lost in Onitsha and Delta State, as well as Abia State, where a civil defense officer shot a driver conveying food items to a destination. So my question is there any other measure that can be put in place to address this, especially some of our colleagues that go out daily still experience the harassment from these security agents, stopping them and not allowing them to get to their place of work? So the IG is not here. Maybe the chairman can answer this if there are other measures that can be put in place to address this. Thank you very much. Nasusibo, Nasonsa, Otumbu wana homaka, Mbazinyego, Aboro IMF, where Otumba and the Africa, how were for ego, nke ha biri. Naju, ka emere ihe a, ala Nigeria esoghị na ndị agụpụrụ na ego ndị a gbatinyere. O nwere ka gọọmenti etiti si eleba anya na nke ịhụ na ha yọrọ otu IMF ka ha nwee ike kpọbata ala Nigeria, ka anyị hụrụ na ọnọdụ nke ọrịa korona butere ugbu a o dewela ụwa dum na ọnọdụ ihe ịgba anya mmiri na nhụju anya. Ọ ga-amasị m ma ọ bụrụ na a ga-asị nke a n'asụsụ Igbo. Thank you very much.
Good afternoon, Chairman and Ministers. My name is Femi Ogunsola. I am with the News Agency of Nigeria. So, considering the fact that the task force is making frantic move to forestall the further spread of COVID-19 to the country hinterland, sir, don't you think the National Orientation Agency is actually critical to stop the spread of this virus via sensitization, creating awareness, because I've seen some comments, especially on social media, bringing saying NOA is not actually doing enough and stuff like that. And the ministry, the agency, some of the agency staff are actually accusing the Ministry of Information of actually trying to take up their role. So what do you think can be done to bring in the NOA? Thank you.
Good afternoon, sirs. My name is Shaki Hassan from Voice of Nigeria, the Arabic service. I would like to speak in Arabic for the benefit of my listeners. السؤال الأول: هل يوجد أجنبي من الذين من ضمن هؤلاء المصابين في نيجيريا؟ الثاني: هل هناك قائمة صحيحة حول عدد الأجانب المقيمين في نيجيريا؟ وهل هناك خطط لاستفادة من مساعدات الحكومة النيجيرية؟ I will speak in English. My first question is, do we have a foreigner among the confirmed cases in Nigeria? That's the first question. And sorry, my question goes to either the Foreign Minister or the Minister of Interior Affairs. The second question is, as we all know that there are foreigners residing in Nigeria, either legally or illegally, and it's not all of them that is doing well financially. Is there any plan that they are going to benefit from the government palliative? Thank you.
Good afternoon, Mr. Chairman, members of the PTF, my colleagues. My name is Mohammed Salih Nazif. I work for Voice of Nigeria. I have two questions, one for SDF and another one for DG NCDC. Let me start with DG disease control. Sir, in your submission the other time, you alluded that a clinical trial and research is ongoing in respect of finding cure or vaccines that has to do with COVID-19. As it is now, I want to know if there is any collaboration between NCDC and our various university research departments. Are you carrying them alone? Looking at universities are down now. To SGF, I don't know if government has budgeted specifically money for research in the area of finding cure for COVID.
We carried out since the pandemic started for COVID? Well, this is a question that came in from a civil society organization, and they're asking why you have not made public the names of the 2,600 inmates that were granted freedom by the president. And also, they need to know the state, something about the 2.1 million naira, that some sort of contribution. So they said he would understand what they're referring to because they had written to you to get an update of that. And finally, really, the next one is to the Minister of Information and Culture, Lai Mohammed. Well, yes, I do know that, yes, with this briefing every day, more and more Nigerians are becoming more aware of coronavirus and the magnitude of what we're dealing with. But unfortunately, even the satellite towns in Abuja, it seems people don't know what we're fighting against. People are still going about their regular business. Some of them, maybe they don't come to the towns, they don't go to their stores. But in the satellite towns, people are exercising in their hundreds. No social distancing, no one is wearing any mask, and I'm worried about the community spread. So really, how are we targeting this group of people, beyond even the FCT and other states as well, to get them to be more aware as to what we're dealing with? Thank you.
Good afternoon, Mr. Chairman, PTF members, and my colleagues. Rachel from the News Agency of Nigeria. My question is for the NCDC DG. So I would like to know if Nigeria have a uniform guideline for discharging patients treated for coronavirus. Now, the SGF made mention that we can now use our Ankara and Shedda for face masks. Now, if the surgical mask covers 22 to 65, if I'm not right, percent of particles, is it any kind of fabric we are meant to be using to make masks? Thank you very much.
Good afternoon, Chairman and members of the Presidential Task Force and my colleagues. My name is Mitaire Ikben. I report for the Nigerian Television Authority. I want to ask, is there any grant for the garment factories and tailors to encourage the production of face masks at this time? Is there any specific grants for them? And again, the Honorable Minister of Health said that there is no shortage of personal protective equipment, but some health workers in some hospitals in Abuja, especially the FMC Jabi, are saying that they don't have enough personal protective equipment. So I want the Minister of Health to respond to that. And when will the distribution of palliatives to senior citizens and the aged commence? Thank you.
Good afternoon, members of the Presidential Task Force. My name is Yemi Adebayo from AIT. I just have two questions for the PTF this afternoon. The first goes to the Minister of Foreign Affairs. There are a lot of Nigerians who are stranded there and wants to return home. And I can remember vividly last week, you did say that the ministry is meeting with the various embassies of the country outside to actually collate the number of those who are willing to return home. I want to find out, have you done that? Then what sort of measures are you going to put in place immediately you collate the number of those who want to return? Then, SGF, sir, I think the PTF will need to meet with the top security chiefs in terms of enforcement of lockdown. A lot of Nigerians are complaining that in the process of this security personnel enforcing this lockdown, there is a high level of infringement on their rights. Their rights are being infringed upon. Some perhaps being beaten up for not following perhaps the processes or not. So I want to find out, are you going to meet with security operatives to actually talk to them to be more civil in terms of dealing with Nigerians at this time? Because 2 weeks lockdown just gone by, we are in a new one, and people are really not too comfortable with the situation we are now. Thank you very much.
Thank you. That brings us to the end of the questions. The questions have been directed at the Honorable Minister of Health, the Director General, NCDC, Honorable Minister of Foreign Affairs, Honorable Minister of Information and Culture, Honorable Minister of Interior, and the Secretary to Government of the Federation. We shall begin with the Honorable Minister of Health. Minister of Health, please.
Thank you very much for the questions. They are cross-cutting, so I will answer those ones that are in the health sector, particularly with public health. The DG will address those ones. Now, I will start with the question of the spread of the virus and the orientation and awareness creation. The virus is carried by people. Persons who move from one place to the other. Many of them may not even have any symptoms at all. Some may have symptoms and think they better run home to go and cure themselves. Maybe get to the village or get to their community. And that's exactly what the lockdown is supposed to prevent. Because you move from one place where the virus is prevalent and carry to another place where it is not prevalent, you are going to endanger the community. The lockdown is to stop people moving and probably mistakenly taking the virus to where it was not before or where we don't want it anywhere. So we urge people again to respect the lockdown, stay where you are, and follow the advisory. If you have any symptoms, go straight to see a doctor or go to a site where you can get testing so that you can get your treatment exactly on the spot instead of traveling in a bus in which many people inside the bus will be endangered, or going to a community where people who didn't have COVID now get it from you. That is not a good gift to take with you anywhere. So clinical trials, yes, there are clinical trials that are going on. The World Health Organization set out an initiative called Solidarity that is to collate experiences from various countries treating coronavirus infection using different protocols. And the Nigeria centers are participating in that and studying what they need to do to contribute to finding a solution. A lot of them are just trials in that what works is not really definitely clear. Then the question of shortage of PPE. There's a global shortage. If you look, if you watch TV, you will see that even highly developed countries who are industrial countries are complaining that their health workers are short of materials, and some have to look for improvised wear. So there is a global shortage. Manufacturing companies have either reduced their production due to the restrictions from the virus infection, or they are not able to meet all the needs. That's the reason why we are very keen on having a stockpile so that we don't get into a situation where we run short and not give those who need the equipment and PPE what they want. Every hospital has been given a starter pack that you have something on reserve to use just in emergency. If you're actually treating cases, then you will get more. but we are not just distributing them equally so that people can put in their store. We are just giving something that you need, and immediately you have cases you are dealing with, be supplied with more, and leave the central stock to be better managed. These equipment are very valuable at this time, and they need to be used judiciously and wisely. Now, some hospitals that are not directly handling the coronavirus will only just have a few sets, and they will be able to get more if they require more. As for discharge, the discharge is that a person will test negative for the coronavirus 2 times within 48 hours. So if you are tested, you are negative, you are tested a second time after 48 hours, some people make it 24 hours, so you are negative 2 times, then you are good to go if there are no other complications. I think that's what that concerns the health sector.
So thank you, colleagues. There was a question on South Korea and the patient that apparently got reinfected after testing negative the first time. So there are some questions that we will just need some time to answer. Some viruses give a long-term immunity once you've had the first one. The one that we know the most is yellow fever. Once you're infected or you've had the shot once, you're protected for life. Others provide shorter-term immunity, and then you can get the infection again. You need time to study this, and until we have sufficient time, we're not able to really know whether this was an exception or the rule. So we'll keep following up on each of our patients. There are some studies going on already on survivors, people that have recovered. Let me not call them survivors, but people that have recovered and reintegrated into society. So we will think of doing some of that in Nigeria as our patient volume increases. The other question on volunteers, the work that we do is very specialist. It's just like, it's not something you just bring people together and start doing. So what we have a pool of graduates from the Nigeria Field Epidemiology Training Program that are around the country in various jobs. What we have done is gradually integrate them into our workforce. We work with them on outbreaks all the time. So whether it's cholera, Lassa, monkeypox, that's our primary source, at least for the work that we do from the NCDC perspective. And this is very important for people to understand. There are many requests about volunteering, but it's just like, the easiest example to give is the military. You don't just bring people together, give them guns, and say, okay, go and fight. It does take a lot of learning, dedicated efforts. Yes, we have to shorten that period in certain cases now, but a certain level of preparation is still needed before you go out to do this work. The question on research on the universities, absolutely. Universities don't need to be carried along. This is their core mandate. So nobody should wait to be carried along in this work. Everybody should come forward, bring out the ideas, put them forward, and get on with it. The primary institute at the federal level is the Nigerian Institute for Medical Research in Lagos, and you would see their work around sequencing the first virus. So they've been very proactive around this. I think they've just announced they've sequenced 2 more. And so they will be leading kind of on the federal side for research. But we have universities, and that's the core mandate of universities. The question on, I think Amaka asked on tests, we've agreed every Friday at 6 p.m. to announce the number of tests for that week. So look out for it this week. So far, we're just around 7,000, but we want to release the numbers and potentially even a breakdown of what we've tested in every lab within the network. So 6 p.m. every Friday, we'll announce those numbers, so you'll have a picture for the week just passed. I think those are all the questions. The question on masks, on what material to use. The use of cloth masks is really as a physical barrier. The viruses are very tiny particles, so none of it will completely protect you. But on the balance of evidence, what we've said is better that you wear something that reduces, especially when you're in that pre-symptomatic phase. If you're transmitting virus, reduces the burden of that transmission by 50%, 60% is something. So that's really the thinking around that. The mask itself, we can't say it's, the different materials. No analysis has been done on what material is more protective, because the whole thing is really a compromise situation to reduce the burden on transmission, especially in crowded places. And I think as we approach the end of the lockdown, we will gradually take things like that a lot more seriously. And especially in places like markets, places where physical distancing is difficult, we will have to emphasize the use of masks in those settings, because the principle that we talk about, the physical distancing of 2 meters, are very difficult to implement in certain settings. So in those settings, we'll be firmer in the use of masks than maybe other settings where we can actually apply that principle of physical distancing in the closeness of our interactions. So I think that answers all the questions.
N'izu ụka gara aga, ajụjụ ha jụrụ m sụọ n'Igbo, asụ m n'asụsụ ndị agbaenu. So ndị be anyị sụọ m sụọ n'wawa, na-abụ onye wawa. So eke nwa sụọ n'wawa, abụ onye eke. So unu ghọtakwa na ọkara mma. Mana ajụjụ ha jụrụ m bụ ihe gbasara Ohu Bank na-achụ n'ụwa ha na-akpọ International Monetary Fund. Ashịda na ego na nwere obodo iri na asatọ, iri na iteghete na ha yechiri ego ka ha were n'uso ayanwa ọgụ, mana na ha eyeghị Nigeria. So ndị ha ka eme ka ha yeghe ndị Nigeria. Mana ihe mgbe ha yere ya bụ ego, ha yechi ndị obodo ego ahụ iri na iteghete na ha chere n'ọsọ obodo dị ogbenye na-enweghị ego ncha bụ ha họpụtara ya bụ ego. And unu amara that na obodo anyị nwa bụ Nigeria, I said that na economy anyị bụ kacha n'Africa niile. So mgbe a na-ekekwa ihe eke ndị obodo ndị ogbenye anyị aka eso n'ime, mana adị m sure na minista anyị na-enete finance na ọ ya eme nnọọ ike ka ahọpụta Nigeria na-anọkwa eke ego ọzọ dịka ọha. So what I was saying was essentially that, the last time actually I spoke in Igbo, I spoke in Central Igbo, So a lot of people wrote to me and said, hey, look, listen, you're a Wawa and you should be speaking the dialect. So that this time I'm going to to speak in a dialect, and I hope that the questioner will understand my dialect. On the issue of evacuation of Nigerians, where we are now is that we have received all the numbers from our various embassies around the world. We are collating those. Then we have now selected 2 airlines that will be responsible for going to fetch them. The numbers are high, and the places where we can isolate them are not enough for those numbers. So we will have to do it in a staggered fashion, and together with the National Emergency Management Agency and the Ministry of Health, we will have to come to an agreement to be bringing back according to the numbers of beds and so forth that are available. But as I said, we have now identified the airlines that will go out in the process. So we're almost ready to go. Thank you very much.
Honorable Minister of Information and Culture.
Thank you very much. I'm sure you don't expect me to answer the one in Arabic. Before we go to the Arabic one, let's treat the one in English. The allegation that the Ministry of Information or the PTF or in particular the National Orientation Agency is not enough to sensitize Nigerians, to enlighten Nigerians about COVID-19 is fake news. It's fake news and it's fake news. And I have the independent polls conducted by the NOIP, which is the most credible company in the whole of West Africa for this kind of polls, which was also sent to us by the UK Prime Minister's Office Communication, which is partnering with us. And the result is this. It says 99% of Nigerians say they are aware of COVID-19. 6% of Nigerians say it is not real. And of this, 6% is broken down to Northwest, 4%, Northeast, 8%, North Central, 5%, Southwest, 3%, Southeast, 10%, and Southeast, 12%. The poll also asked Nigerians this question, and it said that 28% of Nigerians say they are immune to COVID-19. And the reasons they gave are as follows. 42% of them said, I believe in God. 35% of them said, I follow preventive measures. 11% of them said, I'm a black person. 5% said, hot weather will not allow it to catch me. While 4% says, I eat good food. The poll also went down to ask Nigerians, do you think the FG's decision to lock down FCT Lagos Ogun is correct? 18% said it's too extreme. 77% said it's appropriate, while 5% said not sufficient. So if you want more information, I'll give you. But I tell you, this is not from us, from NOI polls. So all this, allegation that there's not enough, public enlightenment is fake news. Thank you very much. The Arabic version and next session.
Thank you very much, Honorable Minister of Information and Culture. We will now take the Honorable Minister of Interior.
Good afternoon, all. I will start with this general message. We must commend the endurance and resilience of all Nigerians over this period of a national war against the invisible COVID-19 on all space of Nigeria. The war is grim and tasking. We must thank God for His mercy as we are thanking our fellow compatriots and the frontline and health workers for their resilience and commitment. Let me seize this opportunity to admonish Nigerians living in our border communities in the states sharing borders with our West and Central African neighbors. And these states are Lagos, Ogun, Oyo, Kwara, Niger, Kebbi, Sokoto, Zamfara, Katsina, Jigawa, Yobe, Borno, Adamawa, Taraba, Benue, Cross River, and Akwa Ibom. These are the states ring-fencing Nigeria from our neighbors in the west to the north and the east. I'm seizing this opportunity to admonish them to promptly report any illegal entry of anybody across our borders and alert the officers and men of the Nigeria Immigration Service. It is in our collective interest to prevent opportunistic entry of COVID-19 into Nigeria by any means. We, as a people and a nation, have sacrificed a lot of our time, energy, resources, and wealth as a people and a nation, that it is best to take the maximum advantage of the gains we are making on the containment of this virus by being alert to any movement at all across our border by anybody except our own citizens, who even as well we must report to the officers and men of the Nigeria Immigration Service. These gains come at a very, very high price. We are all paying it. It's taking tolls on our economy. It's taking tolls on our spiritual life. It's taking tolls on our social life. So we must therefore not take it for granted. We must support the government to keep our borders secured against the virus. This said, I owe the lady who spoke in Arabic first and later English just this answer. In the speech I made on Thursday last week, while delivering the president's message on the release of some inmates in our custodial centers, I titled that speech, "Compassion is the basis of morality." It's not a slogan from me. One German writer said so, and I agree with him absolutely. Our hospitality, our philanthropy, our high sense of compassion are the classical hallmark of Nigerians. So, no foreigner from West Africa, Central Africa, or outside Africa will suffer neglect or lack of care in any part of Nigeria from Nigerians or by Nigerians and the government. That explains that. Identities of freed inmates. From the speech again I made during that, when I was announcing the presidential amnesty, I was clear that the federal offenders that are to benefit from that first phase, because it's just the beginning, and I made it clear in my speech that that will be the beginning of this exercise. It's going to run for quite a while because of the number we have there. The number of federal offenders that were given amnesty was 70. that the remaining 2,600 were state offenders, that based on the criteria established, the President has approved for the Attorney General of the Federation to contact respective states, and I gave the number of beneficiaries per state that the Attorney General will write on to the states to release, and they are releasing them. I've read about Kaduna and some other states. So please, it's unfolding. And it's not even limited to what we have done. We are committed to decongesting our custodial centers. I could not get the second question about 2.1 million or something. I want to assume the lady from Arise should by now have the correct thing about that amount of money, what it is meant for, what she wants to know about it. I wouldn't know. So if you can please explain yourself, I might be able to help. Okay. Thank you. I've now understood you. It's 21 million, it's 21,500,000 naira. Please. When it comes to money, everybody is oversensitive. What I said in my speech on that day was that as a condition for releasing some, about 800 of the inmates, is the need to pay fine. And we pegged it at those who have a fine obligation of maximum of 50,000 naira, that we have penciled them for release, and that total sum is about 21,500 naira, which we expect the state governments to pay to themselves. Let me explain this because this is quite interesting. FCT paid for his own inmates that fall within that bracket of inmates having fine obligation of maximum of 50,000 naira or below. FCT paid his own sum. I couldn't recall the figure now. And we recommend to the state governments to equally do the same. And let me explain to you what we mean state government paying to itself. A court judgment is already an obligation that cannot be obviated. However, if the state government pays the fine to its state judiciary, the money goes through the state judiciary to the treasury of the state. And it's the state paying itself. It cannot be paid because it's an obligation, being an order from court. So the order must be obeyed by the government paying the state judiciary, and the judiciary dropping it in the state treasury. So it's into me. So it's 21 million naira, 500,000. It's 21,500,000 naira. It's not coming to federal government. It's going to each of the states that have recommended those inmates for release with the fine obligation. I hope that is understood now. It's 21 million. It's 21,500,000 naira. Now on garment. I know the chairman will talk on this, but it's always nice to use the opportunity of this engagement to sensitize our people to what we owe ourselves. It's getting very clear that the tropics does not allow people to huddle in their houses. The tropic is an open space where intensive social interaction is natural. If that is the case, and we now have to live this very difficult and strange life of being indoor, it will be inconceivable, and may God not allow it to happen, that we stay indoor forever. But for economic reasons, social reason, spiritual reason. We can't. If that is the case, the only thing possible, therefore, is to have a minimum prevention system. A minimum system of ensuring that people are prevented from being infected by this virus. And the face mask, to observance of physical and social distancing, personal and hygiene are maintained. So if that is the case, let's take our population to be 200 million. Let's say half of that population are active, semi-adult to full adults. It's more than that, but let's even say half, 100 million. Let's now assume that the cost, I don't know, I'm just assuming, don't quote me. Let's assume that the cost of local production of this guard is 500 naira. That business alone of mass production will generate a 50 billion naira business. So if that is so, I want to recommend this. Rather than look at government for grant, let individuals that can mobilize seamstresses in their respective area to produce this thing and help people in the community. Let chairmen of local government areas, let councillors, let officials of government and those with means support this exercise by mass producing from local producers, seamstresses, ladies, women who can do this. We have been told by experts that our ordinary textiles can go a long way in producing this mask and serving the purpose of preventing the droplets of the virus from attacking us. So I'm with this appealing, or I'm by this appealing to all of us that have the capacity, one, to organize seamstresses in our respective communities, leaders of community, leaders of religious organizations, health associations, trade and social, political leaders, everywhere. Let's come around to support the containment of this virus by mobilizing those with capacity to produce masks with our cloth that we can use year round. I'm quite hopeful that with this, in no distant future, Nigeria will be a safe haven and a no-go area for coronavirus. I thank you for your attention.
Thank you very much, Minister of Interior. We shall now take the Secretary to Government of the Federation. Just to wrap up, sir.
Yes, thank you so much. There was this question that had to do with synergy with the states, as if we are not working in concert. Paragraph 2 of my speech this morning did emphasize that when I said that the Presidential Task Force continues to monitor developments around the country and provide guidance to the subnational entities and all other Nigerians on measures being taken. We are working in a collaborative manner with states all over the Federation. I have been in contact with them through the Governors Forum. And even yesterday, after our video conferencing meeting with the President, the DG Center for Disease Control and the National Coordinator of the PTF were on with them for several minutes discussing synergy and how we can harmonize our response so that we have one national response. I must commend the states because they are doing a good job. But you heard me say this morning that this is not the time to relax any lockdown. A state has gone from one index case in under 1 week to 21. So it's a serious business, please. It's not a joking matter. And this is not the time to play any game. It is only our collective resolve as a country that can help us deal with this pandemic. So I'll continue to emphasize the fact that we have one national response and scientifically proven the only way you can drastically reduce transmission is through the lockdown. Once people don't come in contact with each other, we'll be able to trace those that have appeared on our radar as persons of interest, follow them up, track them. If need be, test them. If they are positive, take them into isolation, remove them from cohabiting with other people that are not infected, take them into isolation, and give them the appropriate care. But as long as we allow business as usual, people getting together, partying, then we should be prepared. We should be prepared to deal with the consequences of our actions. So I will continue to make this a passionate appeal. That given these 2 weeks, I must commend the governors that have taken bold steps in locking down their states so that the needful be done. The Quarantine Act signed by Mr. President has direct bearing on Abuja and Lagos and Ogun. So we have responsibility to ensure that this lockdown in these 3 locations are effective and geared towards producing the desired results and objectives for which the extension is granted. And that brings me to the second question that talks about difficulties of accessing movements and harassment by the law enforcement agencies. I'm not holding brief for the Inspector General of Police and all the other security agencies. But you know where I stand on this matter. I've spoken about it some time ago when I said it's a Nigerian phenomenon. And civility is reciprocal. If you are civil in your approach, you ordinarily attract a reciprocal civil attitude from the other party. And it's a cultural issue, it's a mind issue that I believe strongly that in spite of what COVID-19 is doing to us as a people, but coming out of it, I believe we will learn very good lessons and we'll begin to deal with matters and deal with ourselves in a different way. I expect that our security agencies will be polite in interrogating whoever desires to have access during this time of lockdown. And that is why I said in my speech this morning when I said I was requesting the security agencies to please exercise patience in communicating. I mean, our people should exercise patience in communicating with the law enforcement agents assigned to ensure compliance with the presidential orders. They are there to protect us. But in the same vein, the security agents too are not expected to be overzealous in dealing with our people. I totally agree. Having been locked down for 2 weeks, and particularly for those that earn their means of income on a daily subsistent basis, there is anxiety, there is apprehension, and the pressures of life kick in at that particular moment. But this is a time that we must exhibit decorum, we must be patient with each other, we must try as much as possible to endure and accommodate sometimes even excesses. Knowing the Nigerian people very, very well, because I'm one, this is not the time to take undue advantage. This is not the time to take undue advantage. This is the time to show our true sense of nationalism in this regard, and to ensure that we do everything collectively to have an upper hand in our fight against COVID-19. So in summary, what I'm trying to say is that as much as possible, the security agencies should be patriotic in their actions, should be accommodating, should be polite, and should restrain themselves even in the face of provocation. But in the same vein, the civilian population too should be civil in their conduct. And lastly, the question that has to do with whether we have a budget for research. I can assure you that we have a budget for research, and we are partnering with the Nigerian Institute for Medical Research, because this is a novel virus. Even from the place from where it originated, they are busy trying to lay their hands on possible vaccines or other drugs that can be used for the purposes of cure. So every country is mixing whatever they can mix. Here in Africa and in Nigeria in particular, we would put a little bit of the Nigerian sense in it, like the Honorable Minister for Aviation said here, in his part of the country where he comes from, people are saying that they can eat some fruits, they can swallow some things, but that is not scientifically proven. We would do the needful in terms of a proper medical research to see if Nigeria can have a leeway or a headway in getting to the creation or invention of a vaccine or a combination of drugs that can be curative dealing with the coronavirus. As of now, there is no cure that has been proven scientifically. There is no vaccine in the market that can be administered. All we are doing is to put in place the non-pharmaceutical initiative and the medical care that can be given to those that have been infected. I want to thank you.
Thank you, SGF. That brings us to the end of today's national briefing. One significant message that has come out today is that please do not stigmatize anyone who has survived COVID-19 infection. The virus does not discriminate. Allow the humanity in us to always come true. I Thank you very much for being part of this program. Particularly, I must thank all the media houses that have transmitted live. I thank NAPTIP and Sight Savers Nigeria for supporting us with the sign language for today. God bless all of us. Thank you.
It is a matter of life and death.
This is Nationwide. We are live on the network service of the NTA. Thank you for joining us. I'm Hawa Salihu Adama. As at 20 minutes past 11 o'clock in the evening on Wednesday, 15th April 2020, 34 new cases of COVID-19 were reported in Nigeria. 18 of the cases are in Lagos, 12 in Kano, 2 in Katsina, and 1 each in Delta and Niger states. The new confirmed cases bring the total number of cases to 407. 128 of the number have been discharged and 12 deaths recorded. Let's now join NTA's Mitaire Ikpen standing by live at the conference hall of the Office of the Secretary to the Government of the Federation, venue of the daily briefing by the Presidential Task Force on COVID-19. Mitaire, what are the major highlights of today's briefing?
Thank you, Hawa.
If you can hear me, I just asked if you could take us through the major highlights of today's briefing.
Hello, mic testing, 1 2 1 2, mic testing, 1 2. Are you on?
Well, before we rejoin Mitaire later, let's move on. As the 2-week extension of the lockdown enters day 3, Olabode Arewa reports that security agents are having a hard time enforcing the lockdown in some suburbs of Abuja.
At the Jikwe and Karu areas of the FCT, the lockdown recorded limited compliance.
Since I have been around here, there is free movement. Okada are moving.
The issue of lockdown, anyway, is our own benefit favor. You understand? Because we don't know who is who. I may have the sickness. Why you don't know?
Well, I just came out to get kerosene now to cook, and the place, there is no kerosene, there is no market. So we are not really finding it easy at all. But we say thank God. I will go back and find another alternative because it's for our own good.
At the Yanya-Maraba boundary between the FCT and Nasarawa states, health workers were on ground to check motorists and passers-by at the hectic time.
As you can see, the work is going on, and we ensure that the total lockdown is effective.
The 2 weeks lockdown in Abuja, Lagos, and Ogun states was renewed by the president on Monday night. In Abuja, Labrador, NTA News.
I understand Mitaire standing by at the conference hall of the Office of the Secretary to the Government of the Federation is now ready for me with highlights of today's briefing. Mitaire.
Okay, Howard, like pointing out earlier, the Presidential Task Force has encouraged tailors and garment factories to take advantage of face to produce locally at this time using local fabric. There will be more community testing. The coronavirus contain the spread of the pandemic, and also there will be more social mobilization in the grassroots to encourage wearing of the face mask. Again, the Minister of Interior has encouraged Nigerians in border communities to report promptly any foreigner that enters the country illegally through the land borders as a measure to prevent the spread of the coronavirus. That's it from here. Howard.
Thank you, Mitaire, for the update. And a report just in says President Muhammadu Buhari has been commended by the Center for Ethical Rebirth among Nigerian youth for taking the prudent step of extending the lockdown in the Federal Capital Territory, Lagos and Ogun states to contain the spread of COVID-19. In a statement by the group's president, Chuks Akamadu, the group, which observed that the president's decision portrayed responsive leadership, warned youth in the country not to use the extension of the lockdown to engage in vices, but to stay safe and productive in the society. And from 2 confirmed cases last Friday to 21 confirmed positive cases and 1 fatality now in Kano, there are rising concerns on how best to control and contain community transmission of coronavirus in states like Kano. We have Abdullahi Mustafa in Kano. He joins us now with an update on the situation. Abdullahi, give us a sense of the general ambience in Kano since news of more cases hit the streets.
Surely, the news of the increasing cases, especially the one announced last night, really changed the narratives here in Kano, because previously many people have the feeling that this COVID-19 is a disease that is being heard or seen far away, is not for them. But with the index case and that some of the subsequent results turning out positive of some contacts traced from the index patients is making people to realize that this disease is real and community infection is really possible if the precautionary measures are not observed. So you see people now using personal protective equipment, observing that social distancing, and of course using other like hand sanitizers and hand washing. Because someone even, this is a personal experience, someone a few days ago wanted to greet me, I refused to shake hand with him. But this morning he was calling me where he can get hand sanitizer. So this is a typical example that people have really changed their attitude towards COVID-19.
Coming from Kano. But is there a sense of urgency by the state government to contain further spread? And is the response modalities being aligned to tackle the new reality?
Yes, because even before the confirmation of the index case in Kano, there were measures like closure of schools, offices, and courts, which that one is nationwide. So 2 days ago, 2 days ago, the governor announced a total lockdown, which begins 10 p.m. tonight. And this is to ensure that contact tracing is done effectively, because the governor, during the announcement of the index case, was saying that the challenge is of contact tracing, because many people came in contact with him because he has been to various public places like mosques, condolence visits, as well as wedding ceremonies. So this measure will surely help government to trace those contacts and get them tested for the virus.
So much for that update from Kanu. We appreciate your contribution. Moving on, the Presidential Task Force on COVID-19 has been commended for effective coverage of the nation's health system during the initial 2-week lockdown and determination to tackle emerging cases within the period of extension. Abubakar Usman Akwanga reports that Nigeria Governors Forum made the commendation during a teleconference meeting with critical stakeholders in the fight against the coronavirus pandemic.
The forum expressed satisfaction with the performance of the Presidential Task Force on COVID-19 and the NCDC. The Governors Forum commenced the delivery of essential equipment, distribution of palliatives to vulnerable persons, as well as synergy with Coalition Against COVID-19 to support states' response to the pandemic. The forum also engaged Aliko Dangote, Herbert Wigwe, and Governor of the Central Bank, Godwin Emefiele, on strengthening mechanisms to reach more vulnerable groups and improve on existing health facilities. Chairman of Nigerian Governors Forum and Governor of Ekiti State, Dr. Kayode Fayemi, says the forum will constitute infection prevention and control committees to support the role of health workers who are at the front line of the pandemic. He said hotlines have been established across states to ensure emergency services are integrated into operations of the task force on COVID-19 and promised to review operations of businesses during the lockdown. In Abuja, Abubakar Usman Akwanga, NTA News.
Residents of Abuja along the airport road are soliciting government intervention concerning the high traffic being experienced in the last 3 days. Haman Jabani reports.
Oh, what do you want me to do? Where is your ID card? Good, so go. I've allowed you to go. But I will not allow others to go. You say you want to clear my doubt. How dare you?
This is the scenario on the airport road coming into the city center. All members of the force are on ground to ensure that those who are out without reasons are turned back as motorists struggle to pass the checkpoint. Christiana Issa, a staff of National Hospital, says she has been stuck in the traffic for 3 hours. She believes that a better plan could be applied to avoid what she calls an unnecessary delay.
Now reaching here, they have stopped the integrity, dropped me here. And now I don't know how to reach. Should I turn back home and receive credit from my boss? Should I check to the hospital? I don't really know what to do next.
Some motorists that spoke off camera agree that most people plying the roads have no business being outside. Although the task force personnel declined commenting on camera.
Appealing to the public, they should stay at home. The order put in place by the government is not for the government interest to ensure that the community transmission of this COVID-19 is stopped.
Hamman Jabani, NTA News.
And in a related development, it's day 17 of the lockdown measure to contain the spread of COVID-19. And workers on essential duty are still out and about. Are they complying with traffic rules? Najatu Tijani investigates, focusing on the Central Business District.
Central Business District, known for ministries, agencies and parastatals, even the Federal Secretariat, is devoid of vehicles except for a few who are possibly workers on essential duty, a few civil servants, if you may. Which brings me to this question: what do you do when the streets are practically empty? So empty, in fact, that I can walk onto the street unhindered to do my piece to camera. With this situation, motorists were, however, compliant when it came to observing traffic rules, as was observed around Muhammadu Buhari Way in Area 11. So are you complying, keeping to the time?
Indeed I did, because I'm a essential staff. That's why I'm out. Otherwise I would have been home.
Out because it's part of my business.
But on the outskirts, some motorists took advantage of the lockdown and the low traffic to break the traffic rules. That was the situation which led to this accident. The parties involved declined to speak on camera. Authorities used the opportunity to call on workers on essential duties to always abide by traffic rules no matter the situation. Naja'atu Tijani, NTA News.
Thanks, Naja. And as we continue to assess the level of compliance with the restrictions in place to curb further spread of coronavirus in Nigeria, we also gauge the effectiveness of some of the steps taken by authorities to promote adherence and deter people from indiscriminate abuse of privileges also granted by the government. I have our correspondent in two locations in the Federal Capital Territory, Naja'atu Tijani, as you saw, now joining us live from the Central Business District, and Tessie Omeri, also standing by at a checkpoint along the Airport Road, here in the Federal Capital Territory. I'm going to start with Naja'atu. Naja'atu, you've been actually on the streets all through the day, and I'm just wondering, you've reported that the metropolis has had a high level of compliance in the last 2 weeks. From your findings, is that tempo likely to remain or improve? I could also ask if you suspect the tide might shift if the restrictions get prolonged.
Well, first of all, I'd like to say we've been here since about 4 p.m., going around to observe the level of compliance. Earlier on, we were at Garki, where we noticed that people were in compliance with the directive, and they were also sticking to traffic rules, which is a different ball game altogether on the outskirts in the suburbs. And since we've been here at the central area, we're actually close to the Federal Ministry of Health headquarters at the Federal Secretariat. Cars have been steadily driving out of the Secretariat. That's assuming they've closed for the day and they're all going home. From 4 p.m., the roads were actually empty. But now the tempo has picked up because it's obvious that they've closed for the day. So far, what we've observed is that there's been compliance.
And join Tessie, who is somewhere around the Airport Road. Tessie, is it a challenge sieving essential workers from the non-essential workers plying the Airport Road?
Many thanks, studio. Right now, we are at the Dantata Bridge, Airport Road, one of the mobile courts venue in the FCT. Remember, we have 3 mobile courts, one in Pape, one at AYA. And this was set up by the FCTA, to further contain the spread of COVID-19. And also because of the fact that people have been violating the lockdown orders of stay at home.
Will you say these mobile courts are? How effective will you say the mobile courts are?
what I have observed so far, the mobile court is actually effective. In fact, as I'm talking to you right now, the mobile court is still sitting. We have a number of cases that are still being prosecuted. And so far, they have prosecuted 14 cases ranging from different offenses of violating the lockdown order. Remember, it is only essential service providers that are supposed to ply the road. But what we have, people are pretending, some would say they are going to the hospital, whereas it's not so. And then the mobile courts are here making sure that only essential workers are on the roads.
There could be some genuine cases of people going to the hospital, really. How are those addressed? There could be some genuine cases of people going to the hospital to see doctors. How are cases like that addressed?
In fact, I have with me the Directorate of Road Service, Wadata Bodinga. In fact, he has just assisted in one of such cases where the person genuinely was actually going to the hospital, but he was stopped here by the mobile court. And I have with me here who is going to shed more light about some of the cases.
Thank you so very much for having me. As you can see, we are here live at Lantata under the bridge. And so far, we have done about 14 cases, while we'll have about over 16 other people waiting to face the magistrate. This is just one point where this magistrate is actually being set up. We have other points that are presently operating at AYA and Mpape.
What we can get from you now, we need to go back to our locations. For you from this location, it's back to you in the studios.
Thank you very much, Tessie, for your contribution. And I guess, Naja, if you can hear me, thank you for joining us on Nationwide today. And we will take some messages now. When we return, more reports. Do stay.
This is not a joke. It is a matter of life and death. Mosques in Mecca and Medina have been closed. The Pope celebrated Mass on an empty St. Peter's Square. The famous Notre Dame Cathedral in Paris held Easter Mass with less than 10 people. India, Italy, and France are in complete lockdown. Other countries are in the process of following suit. We cannot be lax.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Dear brothers and sisters, in view of the COVID-19 pandemic we are currently challenged with, we at Al-Habibiyya Islamic Society enjoin all Muslims to adhere strictly to government directives geared towards stopping the spread of the virus. These measures include the stay-at-home order, washing of hands with soap and water, using hand sanitizers where water is not available, and other hygiene measures. We remind you all of the words of Allah in the Holy Quran, chapter 2, verse 195, which says, "And do not throw yourselves with your own hands into destruction." We also remind you of the hadith of the noble prophet Muhammad, peace be upon him, which says, "Do not cause harm or return harm." Please stay at home and stay safe with continuous dua. This message is from Project Itfine of Al-Habibiyya Islamic Society. Al-Habibiyya Islamic Society, from Allah to you, a light.
Now believe this Koroti. You know, if you touch black man, if you like, gather the whole Niger, come together, make a cough. Nothing.
Which one you want?
Give me V&D.
I beg, get small pieces.
How much you want to give him?
Give me 200. Take your change now. You don't want your changes.
My people, this coronavirus, na serious matter. No, now wash your hands regularly.
come use alcohol-based hand sanitizer. If you no see water, wash your hand, oh, make una sit down for house. You see this virus, so e no get leg. Now we dey waka kurukere. No waka around, make the virus for die. No forget, say, the betterment of our people. Now for your handy day.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency with support from MacArthur Foundation.
Wetin be this coronavirus thing? Na true?
You see this coronavirus wey be COVID-19. Now the whole world palava, and it don't dey kill many people for China, Italy, UK, US, Spain, and even for other countries them.
Okay, wetin come be the reason wey dem say make everybody tanda for house?
Now because if e dey waka pium go carry am from person wey don't get am, you go carry come give your family them. Now so the thing take dey kill other people for other countries.
Okay, wetin come be that social distancing sef?
You see social distance. Now make we no come close, oh, because this thing now from air and touch now we dey contact am. We suppose dey at least 6 foot away from each other every time.
So okay, no be only to wash your hand and to sanitize them alone.
Make we no take this washing of hand thing take play, oh, but make we come together, join hand as we take pursue Ebola, pursue this coronavirus. Make we be each other be keepers.
Thanks for rejoining us. We now take you straight to our Lagos Network Center where Jennifer is on standby with more reports. Jenny?
Thank you, Hawa. Now, the extension of the lockdown in Lagos, Abuja, and Ogun states has further driven home how devastating COVID-19 is and demonstrated the seriousness of the federal government to curb the spread, especially to communities. Abolore Ogbara reports that despite the challenges some Lagosians say they are experiencing, there is improvement on compliance with the stay-home directive.
It has become necessary to extend the current restriction.
Following the announcement by President Muhammadu Buhari that the lockdown to curb the spread of COVID-19 would be extended, most Lagos residents have remained indoors in compliance with the directive. Many commercial areas in the state are still devoid of bustling activities. The same level of compliance that was observed by most business owners is still conspicuously the norm. Some residents shared their experiences as a result of the lockdown.
The government is working. Even me, I love it and like it. To say that to stay at home. And all those our headers in living our this street is give us something like indomie, like bread, like everything like that. I'm very happy.
All what they give me food stuff. I manage my wife and my kids.
Most Lagosians are hopeful that normalcy would return to Lagos after the lockdown and other measures to contain the spread of COVID-19. In Lagos, Abolore Ogbara, NTA News.
And to the ports, the federal government's goal of efficient port operations to stimulate economic activities during the COVID-19 lockdown is facing challenges, as some key players are decrying the failure of terminal operators and shipping companies to fast-track the clearance of cargoes and containers. Michael Olaleye reports.
In recognition of the pressure the COVID-19 pandemic is imposing on businesses, some palliative measures were announced to aid the operations of port users. These include suspension of collection of demurrage and storage fees on consignment already at the seaports for an initial 21 days effective from 23rd of last month. It was a development that brought a hope of great relief, but these port users and forwarders are saying that 3 weeks since the directive was issued, these fees are still being paid.
Since the regulators made it very clear that they should not collect
demorages from freight forwarders. I don't know the reason why they are collecting the demurrage. For what?
Michael Odo Emina is a freight forwarder. Apart from incurring expenses due to the non-implementation of the demurrage waiver, he said there was still delay in getting shipping companies to clear goods already paid for. This is in addition to the inability of most banks within the port community to operate optimally.
The issue is not even collecting that charges. They are collecting without the service delivery. For you to get a debit note, it will take you nothing less than 2 weeks.
And without the receipt of payment, you cannot go on for easy release. And at the end of the day, for that same 2 weeks, they will charge you detention.
The Consumer Affairs arm of the Nigerian Shippers Council says it is aware of the frustration encountered at issuing clearance receipts.
When there is a service failure, the onus lies on the receiver of the service to come and report to the Nigerian Shippers Council. We are not spirit. It is only when you report to us, that we can attend to your problem. And there are some effort being put in place to ensure that the delay is being eradicated.
Port users are optimistic that the prompt resolution of these challenges will help the industry fulfill its mandate in line with the presidential order during the lockdown. In Lagos, Michael Olaleye, NT News.
Thank you, Michael. Back to you, Hawa, for more on Nationwide.
Very well, Jennifer. And moving on here in Abuja, as measures from federal government on ending the coronavirus pandemic increase, governments at subnational levels have also been speaking on taking a cue and advancing advocacies to curtail the spread of the virus and protect the lives of Nigerians. This was highlighted on NTA's Good Morning Nigeria as discussion continues on COVID-19 situation reports in state. Over now to Olusheye Adiabu.
Stopping the spread of COVID-19 in Nigeria and even ending its scourge, the guests believe is possible with existing synergy among the concerned actors and the support of Nigerians. Though no cases has been recorded in Nasarawa State, despite its proximity to the Federal Capital Territory, where COVID-19 cases keep increasing, Governor Abdullahi Sule is optimistic the measures put in place will keep COVID-19 at bay.
We also went ahead with the building of our isolation centers. So today we have isolation center, that is almost completed of 300 beds.
For Anambra State's Commissioner for Information, since the index case was recorded, contact tracing has been effective and the state is equipping itself with medical facilities for
We do not have capacity, for testing, and this is one of the things that His Excellency the Governor is trying to see if we can have rapid, test kits.
As at 11:20 p.m. 15th of April, on the NCDC Twitter handle, 19 out of Nigeria's 36 states and FCT have cases of the pandemic, and guests on the program stressed the need for citizens to strictly comply with all regulations and hygiene practices. In Abuja, Olusheye Adiagbo, NTA News.
And for the next set of reports, let's join Kemi in our studio in Ibadan. Hello, Kemi.
And welcome to Ibadan. As the nation continues to grapple with the economic impact of COVID-19, property owners at a popular market, Dugbe-Alawo in Ibadan, are counting their losses following a devastating inferno that gutted the market. Dario Bushala has the details.
Like the chaotic situation witnessed yesterday during the Region Inferno, the victims of the devastating incidents are coming to terms with the sad reality.
It took me close to 30 years to be able to, place all this in, to work and raise money to place all this in that got burnt yesterday. So where to start from now, I don't know. The air condition, freezer, plasma TV, because if you know this shop before, you know that I lose a lot of things. You know this shop.
Oyo State Governor Seyi Makinde and representatives of emergency rescue agencies paid on-the-spot visit to the scene of the inferno to assess the level of damage.
We're battling with coronavirus. We're battling with the social impact of it. We're also battling with the economic impact of coronavirus. And then this. Well, we believe there's a need for the states to have an endowment for disaster.
So they need to start life again. And I think if the government can do its own part and individuals can help them, it's great.
Meanwhile, damage control operations were ongoing by men of the State Fire Service, while victims were putting the remnants of their property together. In Ibadan, Dayo Gunshola, NTA News.
The need for collaboration between heads of border communities and security agencies as a means of curbing further spread of COVID-19 has been stressed. Oyo State Controller of Nigeria Immigration Service, Saleh Abdullahi, stated this during his tour of some border communities in the state. Correspondent Shola Wahid has the report.
In compliance with the directive of the federal government to prevent the influx of people into the country against the spread of coronavirus, Controller of Nigerian Immigration Service, Saleh Abdullahi, visited Iseyin, Shaki and the Nigerian-Benin Republic border at Okerete in Oyo State to ensure that officers comply with total border closure.
247 to man this border. We make sure that what the federal government has said, no immigrant, nobody should enter Nigeria at this moment where we have this coronavirus.
Mr. Abdullahi urged leaders in the border communities to synergize the security agencies towards ensuring that the coronavirus is not spread through the borders.
The security at the border is now very tight due to coronavirus.
Thank God that all your efforts will not be in vain.
He treated the commitment of the Nigerian Immigration Service at ensuring strict compliance on border closure and warned that violators will face the full wrath of the law. In Ibadan, Shola Wahid, NTA News.
And that's it from here. Awa, it's back to you.
Many thanks, Kemi. The Save the Poor Coalition says the creation of the Ministry of Humanitarian Affairs, Disaster Management and Social Development is a bold step to lift the people out of poverty and to prosperity. This is in reaction to a view canvassed by a member of the National Assembly that the distribution of cash transfer register in states was a fabrication and was full of fraud, and that the ministry lacks the capacity and structure to carry out the assignment. Save the Poor Coalition says it is happy that the minister in charge of the ministry has taken steps to update the National Social Register she met on ground, thereby proving that the program is not a fraud. The statement by the National Coordinator, Emeka Eneche, urges Nigerians to support President Muhammadu Buhari's desire in lifting millions of Nigerians out of poverty. And Jenny in our Port Harcourt Network Center is next in line.
Thank you, Hawa. Good evening and welcome. As the fight to curtail further spread of coronavirus pandemic intensifies across the country, 42 secondary health institutions in Akwa Ibom State have taken delivery of personal protective equipment worth millions of naira for their health workers. Clement Barikwe reports that the items were part of donations from the COVID-19 Incident Management Committee.
At the break of any infectious disease, medical personnel are always at the front line in the fight against such outbreak, and their personal protection will either make or mar effort to curtail further spread. This personal protective equipment by the Incident Management Committee and the Akwa Ibom State Hospital Management Board is therefore a morale booster to doctors and nurses in the 42 government hospitals in Akwa Ibom State.
We will ensure that within our power, they will be well protected to do their work. We expect them to know that we are not sending them to the gallows.
Without being in good health, there cannot be any functional development. So because of that, His Excellency the Governor of Akwa Ibom State approved the recruitment of 170 medical doctors, including consultants, 330 nurses.
With this presentation, residents of the state are reassured that all government hospitals will remain open to attend to their healthcare needs. In Uyo, Clement Barikwe, NTA News.
And Rivers State Governor Nyesom Wike has reiterated his administration's commitment to its constitutional responsibility of protecting lives and property in the state. The governor stated these while receiving reports on the achievement of Operation Stink at Government House, Port Harcourt. Ogedi Nyekwere reports.
Governor Wike commended the security agencies for collaborating with the state government to check the activities of criminals. The governor urged the media to also focus on the successes of the State Security Council in the area of securing lives in the state.
We commend the effort of the Commissioner of Police and other security agencies for their collaboration in making sure that this state is kept safe.
River State Commissioner for Police Mustapha Dandaura said the arms were recovered from Ogbolo local government area following credible intelligence reports. He said the arms were hid underground in the forest by the kidnapped syndicates.
The motive of stocking these arms are going to be investigated.
The commissioner assured that the security agencies will continue to work hard to protect lives and property in the state. In Port Harcourt, Ogedi Nyekwere, NTA News.
And Nationwide continues with our After the Break.
Fellow Nigerians, follow the instructions on social distancing. The irresponsibility of the few can lead to the death of many. Your freedom ends where other people's rights begin. The security agencies have risen to the challenges posed by this unprecedented situation with gallantry, and I commend them. I urge them to continue to maintain utmost vigilance, firmness, as well as restraint in enforcing the restriction orders while not neglecting statutory security responsibilities.
And I've got this very important message for you guys. Stay at home. No. Stay safe. Noruma. This is the right thing to do at this time. And don't forget, remember to wash your hands. Sachasia kage samaya sama, sachasia isia kage of mofuma. Together, we'll beat this thing. Are you ready now? Are you ready, man?
As the world combats the novel coronavirus, also known as COVID-19, the Nigerian government is committing funds and donations are coming from the private sector to tackle the virus. The emergency response to COVID-19 should not be abused as an opportunity for corruption. Do not embezzle the funds. Do not extort money from patients. Observe due procurement processes. And all citizens must guard against the peddling of false information. Do the right thing. Integrity pays. This message is brought to you by ICPC and NTA.
Electricity is part of day-to-day activity.
When there is no light, there is no life.
It's as if we have been ostracized here. Our children cannot even live normal lives.
Instead of buying things plenty that will spoil, we are buying it small. For us to go to the market, come, we will spend not less than 250 naira.
There is a lot of fake news and report circulating, especially on social media, on the coronavirus. Do not believe or partake in the spread of these fake reports. If it is not on the official website or news from the Nigerian Center for Disease Control, NCDC, disregard such report. Only together can we beat this virus. Only together can we overcome this pandemic. Follow the instructions and guidelines provided to combat this virus. Most importantly, stay at home. Self-isolate, regardless of your status. The virus doesn't move unless we move. Let us work together to better Nigeria. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
It's nationwide. Thanks for rejoining us. Experts have advised that one of the ways to contain the spread of the coronavirus is by preventing community transmission. This makes sensitization at the grassroots very vital. In Taraba State, campaigns in the rural areas have remained top priority. Joseph Hussein reports on latest efforts made in Jalingo local government area.
Grassroots engagement in the fight against coronavirus is key in preventing widespread of the disease. This meeting involving the caretaker chairman of Jalingo Local Government Council, Adonasol Boboji, with traditional and religious leaders, youths and health workers, as well as other stakeholders, is promoting collective efforts in tackling coronavirus pandemic. Participants are being kept abreast with latest knowledge on COVID-19, and ideas are shared on best strategies to reach out to all rural communities.
At least as a group, when we are organized, minimum group, if it's 5, 10, we also have to take into cognizance the rules of not more than 20 people that already put in place.
Nobody has no boundary. So let us not hide somebody who is coughing, who has all the symptoms.
After enough education, protective equipment are handed over to traditional rulers, health centers, and other stakeholders. Already, the youth are stepping up the game by organizing sensitization and distribution of personal protective items.
We have a very big role to play in carrying out this exercise, because we are the ones that are living with the people.
And therefore, they must adjust to the new normal of social distance, stay-at-home order, and personal hygiene to stop the spread of the disease. In Jalingo, Joseph Sound Otsen, NTA News.
And we now join Abdurrahman in Sokoto for more reports.
As part of efforts to prevent contact and spread of COVID-19 in and around Kebbi State, the Waziri Umaru Federal Polytechnic Birnin Kebbi has embarked on mass production of hand sanitizers for distribution in the state. Nuratanko Akili reports.
The effort of the Polytechnic is coming in recognition of the rising demand of the sanitizers for prevention against COVID-19 and rising concern on the quality of those available in the market. The idea is to produce a standard and affordable sanitizer to meet the demands of the immediate community and equally donate to the State Task Force for onward distribution to the public.
As an institution, we contribute our quota in making sure that the state is clearly safe. And we are happy to this moment there has not been any recorded case. And we are happy to also inform you that it is not just the issue of taking to the state task force, but we have also decided reaching out to other federal tertiary institutions domiciled within KB.
The sanitizer was produced by the Polytechnic Consultancy Service in collaboration with the Department of Science Technology.
The advent of this COVID-19 pandemic, if the sanitizers are not good, people will be deceived into believing that they have sanitized themselves, while in actual fact it's not the case.
Meanwhile, agencies of government have continued to maintain preventive measures against the pandemic by providing hand-washing points in their premises. In Birnin Kebbi, Nuratanko Akili, NTA News.
The National Broadcasting Commission has donated some protective items against COVID-19 to the FM community station of Abdu Gusau Polytechnic Talata Mafara in Zamfara State. The donation was delivered by the Sokoto Zonal Director of the NBC, Jamilu Yahya Jega. Halil Muhammad Umar reports.
In spite of the suspension of official work by most workers due to the stay-at-home order by the federal government, essential staff in various ministries, departments and agencies, including media practitioners, have continued to render services to the people and as such need support to get themselves protected from the COVID-19. This informed the decision of the National Broadcasting Commission to assist staff of FM community radio station of Abdu Gusau Polytechnic in Talata Mafara local government area of Zamfara State with preventive items to guard against contracting the deadly disease. The items, which include face masks, medicated soaps, sanitizers, hand gloves and buckets among others, were presented to the rector of the institution by the Sokoto Zonal Director of the National Broadcasting Commission, Jamilu Yahya Jiga.
Please use it judiciously. Contain yourself. Make sure that each and every staff that is going into the studio observe all the rules. I will assure you that the materials presented to us will be judiciously utilized.
The general manager of the FM community radio station, Murtala Salihu Gumi, had earlier conducted the NBC delegation around the various operational units of the media outfit, where they commended the staff for working in this difficult time. In Gusau, Halir Muhammad Umar, NTA News.
That's it from here, Hawa.
Thanks, Abdurrahman. The Cross River State government has flagged off the COVID-19 response stimulus package distribution towards reaching the poorest of the poor in all 18 local government areas of the state. Paul Abel has that.
The food items here at the Cross River State Food Bank are provided by the state government, public-spirited individuals, and corporate organizations as part of palliatives for the poor and vulnerable in the fight against the coronavirus. To ensure that the stimulus packages get to those it is intended for, the strategy is distributing through religious leaders, traditional rulers, physically challenged, IDPs and refugee camps, as well as door-to-door distribution using the World Bank Register. For some leaders among beneficiary groups like Livunus, who is physically challenged, the sharing formula is the best.
I will make sure they didn't go down to the grassroots.
The category of the people that the items are meant for, let's make sure it gets to them.
The moment these things get to those structures, it gets to the end.
The state government says this is just an aspect of its intervention, as 30,000 naira will equally be provided for 8,000 youths.
This one are for people when no go feel work again. On Tuesday, any young man and woman will not get job will be 18 years to the age of 35, automatic job.
It is hoped that those in charge of this facility will distribute these food items to the appropriate persons. In Calabar, Paul Abel, NTA News.
From Calabar, we go to Makurdi, where the Benue State government has extended measures put in place to halt the spread of COVID-19 for 2 weeks. Governor Samuel Otom, who disclosed this after an executive council meeting, added that the 2020 budget has been reviewed downwards from 195 billion naira to 119 billion due to the present economic reality posed by the coronavirus pandemic. Charles Abba reports.
The Benue State Executive meeting, which centered largely on issues of mitigating the spread of coronavirus pandemic, had in attendance members of the COVID-19 Action Committee. Governor Samuel Otom, who harped on the IMF projection of a worse recession than that of 2016 in Nigeria, announced that apart from the cut down of the state 2020 budget, government is to aggressively pursue mechanized farming to sustain food security.
We're encouraging Benue citizens to ensure that there is no more empty land anywhere in Benue State. Everyone must go into massive cultivation. What we will do is to support our farmers to clear the land so that they can go into mechanized farming.
The governor also gave explanations as to why government has extended the 7 p.m. to 6 a.m. curfew and other measures put in place for 2 more weeks.
This is a continuous process. We are not resting. The committee is not resting. It's working 24 hours.
He assured Benue people that the palliative measures against impact of COVID-19 by the federal government for the less privileged will reach them. In Makurdi, Charles Abba, NTA News.
Police operatives have arrested the killers of late Funke Olakunri, daughter of the leader of the Pan-Yoruba Socio-Cultural Organization Afenifere, Chief Ruben Fasoronti. A statement by the police public relations officer, DCP Frank Mba, says the Inspector General of Police deployed the Federal Special Anti-Robbery Squad to carry out massive manhunt for the killers, and after months of relentless efforts, the police team on March 4th, 2020 arrested one Awal Abubakar, an accessory after the fact of the crime along Shagamu-Ore Expressway in Ondo State. The arrest of Awal Abubakar led to the arrest of two other members of the gang, Mohammed Shehu Usman and Lawal Mazaji in Benin, Edo State, from whom a collection of ammunition was recovered, and one other, Adamu, was arrested in Akure, Ondo State. Investigations so far reveal that the operation that led to the killing was carried out by 8 armed criminals led by one Tambaya. The Inspector General of Police hereby declares the principal suspect, Tambaya, wanted for his involvement in the death of Mrs. Funke Olakunri and promises diligent prosecution of the culprits. President Muhammadu Buhari has joined the diplomatic community in celebrating former Nigerian permanent representative to the United Nations, Ambassador Blessing Akporode Clark, on his 90th birthday. In a statement by Special Advisor to the President on Media and Publicity, Femi Adesina, the President acknowledged Ambassador Clark's sterling contributions to the shaping and implementation of the country's foreign policy during his diplomatic service career, and helping to sustain Nigeria's bilateral and multilateral relations, culminating in his becoming a permanent secretary, Ministry of Foreign Affairs. Sports now with Kene Emagwadike.
Nigerian athletes will soon heave a sigh of relief as the Minister of Youth and Sports Development, Sanda Dare, has concluded plans to float an athlete relief fund. The fund, which will be funded by the proceeds from the National Athlete Trust Fund, partner agencies, corporate bodies, and individuals, will take care of the welfare of athletes, their training, preparation, and participation in major international competitions. The modalities for the disbursement of the funds to the athletes is expected to be worked out with guidelines to be provided by the minister. The Nigeria Archery Federation says its schedule of training programs will be intensified as soon as coronavirus restrictions are lifted, even as archers across the country are advised to remain focused ahead of future continental and global engagements.
The good thing about archery is the fact that it is the real individual sport. It's not a contact sport. You don't need a second person to do your training. If you want to do your training, the manuals are there. The digital manuals are there. The hard copy manuals are also there for you to do your training. So for us here in this part of the world, we haven't lost much except for the excessive training and group trainings that we're supposed to have.
Meanwhile, efforts are being sustained by the Athletics Federation of Nigeria towards ensuring that athletes come out stronger and more prepared to pick tickets to represent the country at scheduled events after the coronavirus pandemic.
For you to attain into these championships, there has to be some level of fitness that you have to be, and training that you have to be on. And unfortunately, athletes are staying at home. So the call now is, the only option remaining is to exercise and practice at home, individually, and then try to, they say necessity is a mother of inventions.
The Federation has plans for both local and foreign training camps for athletes ahead of crucial qualifiers. With Sports Update, Kenan Ima Aburike, NTA News.
And that's Nationwide today. We thank you for watching. Do remember to stay safe. Please stay at home. Good evening.
This is not a joke. It is a matter of life and death. Mosques in Mecca and Medina have been closed. The Pope celebrated Mass on an empty St. Peter's Square. The famous Notre Dame Cathedral in Paris held Easter Mass with less than 10 people. India, Italy, and France are in complete lockdown. Other countries are in the process of following suit. We cannot be lax.
Hi, and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. I hope you are self-quarantining